So I'm Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California. I want to welcome you to our Advocacy and Public Policy webinar today, Navigating Your Care and Treatment, a Medicare Example.
Okay, now let's get back to a Medicare Advantage plan, which it turns out it may be a better option than, sort of taking the puzzle and putting it together with a Medigap plan, right? Let's talk about costs. Costs vary widely, right? Because a Medicare Advantage plan is, again, a private plan, right? That's going to bundle all these costs together. And I know bundling is a bad word sometimes, but now that we fixed the SNF issue, bundling is a very good word. Okay, in that you have to pay, the monthly Part B premium, and you may also have to pay the plan's premiums. Plans may have a $0 premium, and they may help pay for part of your Part B premium. And most of the plans that are Medicare Advantage plans do in fact cover Part D. Above all, they have an annual limit on out-of-pocket costs, right? And once you reach your plan's limit, similar to, private, employer-sponsored health insurance, you'll have to pay nothing for those Part A and B services. But what is, again, important to remember is you are not, if you're enrolled in a Medicare Advantage, you cannot buy, and you don't need a Medigap plan because, again, you can't be in two places at once. Plans must cover medically necessary services that all Part A and B covers, okay? But the Advantage plans also differ on the number and types of these extra benefits or special services, vision, dental, hearing, the only one that was included in the Build Back Better was hearing tentatively. So let's wait and see how that all washes out in the end. Part D is included in most plans, and that so you don't have to join a separate Medicare drug plan. But much like every other health insurance policy, some services may require prior approval before you can, get an MRI, for example. Because of these are private plans, and usually HMO or PPO or POS, in that you need to use in-network providers, much like you would for your current employer-sponsored health insurance. Some plans do, in fact, offer non-emergency out-of-network plans cover, but like when you think about network services, if it's outside of the network or if you have a larger network, you're going to have to pay more. And in fact, you may need a referral to see a specialist. Next slide, please. So here is something that Medicare doesn't like, but I like to think of things like a side-by-side, right? But you can't necessarily compare an Advantage plan and a Medigap plan. What you can do is sort of think a little bit about what are some things that, people would have concerns about, okay? Medigap insurers can reject you or charge a higher premium, again, if you're outside of that 6-month window, okay? Whereas Advantage plans must accept everybody and everyone charges, no one's charged more because of health status. Traditional Medicare, without a Medigap plan, except for those two limited exceptions, has no cap on out-of-pocket expenses, which is still crazy to me. Okay, and those can be really high in the tens and thousands of dollars. Advantage plans can cap out-of-pocket. I mean, it's still $75.50, excluding Part D, but that's better than an unlimited cap, right? And some Medigap plans, when purchased with, traditional Medicare plans, cover the vast majority of these 20% of expenses. And why do I say that? Because guaranteed issue is a thing, right? We know it's a thing because we all went through the ACA 850 times that we have talked about it, but that it's been brought up and challenged, right? Guaranteed issue means that you can continually enroll or maintain insurance. And why is that important? Because currently only 4 states have a guaranteed issue when with respect to Medigap plans. So most people find it surprising when they try to enroll in a Medigap plan and only to learn that, when did you purchase Part B? I don't know, 2 years ago. Okay, well now we can rate based on health status and we can reject you if you're not in those 4 states. And that's highlighted in this little map on the side. And I just sort of did that to remind myself to talk about this guaranteed issue. And I pulled a little facts about, so I was like, well, maybe California is different. Maybe California does have some standards that otherwise some of the other states don't have. On Kaiser Family Foundation's website, you can also go through and sort of see what are the requirements based on states, right? This is from 2017, but unchanged, right? So it doesn't have a guaranteed issue, either continuous or annual, okay? In that the qualifying events, okay, upon retiree benefit changes, sure, you can enroll. Upon loss of Medicaid eligibility, sure, you can enroll. And then you have qualifying life events, which are similar to other qualifying events, in that the beneficiary, if your plan changes, your participating hospital that you need leaves, or it's excluded out of network, which in fact does happen. In those situations, you can in fact switch to a Medigap plan or a Medicare Advantage plan.
Marla, thank you so much. This was super informative and helpful. I want to also thank go ahead.
Sorry, before you thank that sponsor, so you'll send out the open enrollment in California 2022 fact sheet as well as the slide deck, correct?
Correct.
Because there's a lot of really great, it has a link to the handbook, it has all these important dates and deadlines and when things start. It gives you a lot of specifics to California about the Medicare Savings Program and the number of plans offered in your state and what percentage, blah, blah, blah. So
yeah, we'll send that out to everyone who registers.